This capsule is used to prevent a specific intestinal infection, difficile-CDI, from recurring after finishing a course of antibiotics for the infection. It is made from human stool from screened donors and is believed to work by providing healthy bacteria. It is not used to treat CDI. The recommended daily dosage is usually determined by your doctor. It is best to take this capsule at the same time each day. Before you start taking this product, make sure to read the patient information leaflet from your pharmacist. Take this product by mouth as directed by your doctor, usually once daily before the first meal of the day for 3 days. Remember not to eat or drink, except for a small amount of water, for at least 8 hours before taking the first dose. Swallow the capsules whole and do not crush, chew, or break them. The day before you start treatment with this product, and at least 8 hours before your first dose, your doctor will instruct you to take a laxative. Make sure to carefully follow your doctor's directions for all of your medications. It's important to know that this product contains live bacteria, so taking antibiotics may prevent it from working effectively. Avoid taking any antibiotics while using this product, unless directed by your doctor. Continue to take this product until the full prescribed amount is finished, and make sure to consult your doctor if your condition persists or worsens. If you experience bloating, tiredness, constipation, chills, or diarrhea, it is important to notify your doctor or pharmacist. Your doctor has prescribed this product because they believe the benefits outweigh the potential side effects. Most users do not experience serious side effects, but it is important to seek medical help immediately if you notice any signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not mentioned here, it is recommended to contact your doctor or pharmacist. As always, consult with your healthcare provider before starting any new medication. Before taking the Fecal Microbiota Spores, Live-Brpk Capsule, it's important to discuss any allergies with your doctor or pharmacist as this product may contain inactive ingredients that could cause allergic reactions. Be sure to inform your healthcare provider of any medical history, especially if you have kidney disease. If you are pregnant, this product should only be used if clearly needed, so be sure to talk to your doctor about the risks and benefits. It's also important to consult your doctor before using this product if you are breastfeeding. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. As for the daily dosage, it is best to follow the instructions provided by your healthcare provider and take the capsule at the optimal timing recommended by them. Drug interactions can affect how well your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you or someone you know has taken too much Fecal Microbiota Spores, Live-Brpk Capsule and are experiencing severe symptoms like losing consciousness or struggling to breathe, it's important to seek immediate medical attention. In the United States, you can call the local Poison Control Center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center for assistance. It's crucial to act quickly in these situations to ensure the best possible outcome. It's important not to share this product with others. Your doctor may also recommend lab or medical tests, such as stool tests, while you are taking this product. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When you have Fecal Microbiota Spores, Live-Brpk Capsule, it's important to store it in the original container in the refrigerator or at room temperature, away from light and moisture. Make sure not to freeze it and avoid storing it in the bathroom. Keep all medications away from children and pets. And when it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. When it's expired or you no longer need it, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.